Nighttime bathroom sprints are stealing your sleep and your confidence. Left unchecked, this cycle can drain energy and raise avoidable risks in everyday life. Stay with me for a safe, natural path to steady control and real relief. Before we begin, a gentle reminder. This content is educational and not a substitute for personal medical care. We're talking about everyday habits, foods, and simple routines that can support bladder comfort. If you're pregnant, nursing, dealing with kidney issues, recurrent infections, or using prescription medicines, check in with your healthcare professional before changing routines. Here's the truth I wish someone had told me sooner. Age does not automatically equal surrender. The bladder changes with time, yes, but those shifts are often responsive to what we do all day. Muscles lose a bit of spring, nerves get jumpy, hormones fluctuate, and suddenly the distance between you and the nearest restroom feels like a strategy game. I've been in that parking lot moment where you're weighing whether to grab the groceries or sprint to the bathroom. What surprised me is how quickly the body can become more cooperative when we make a few deliberate, gentle changes. Let's start with a picture you can hold in your mind. Think of the bladder as a flexible reservoir with a smart valve system at the base. The detrusor muscle wraps around the bag like a patient hand. The pelvic floor provides a supportive sling. With age, long hours seated at the laptop or in the car, low-grade stress, and certain drinks common in North American routines, big mugs of drip coffee, afternoon sodas, iced tea refills, evening beers, begin to nudge that system into overreacting. The muscle tightens when it should wait. The brain interprets small stretches as urgent messages. And because urgency is uncomfortable, we go just in case, which trains the bladder to expect frequent trips. It's nobody's fault. It's conditioning. Here's where it gets encouraging. Conditioning also works in the other direction. When irritation drops and the nervous system feels safer, the muscle and the brain relearn a calmer pace. I'm going to show you how to create that shift with realistic steps you can apply between work calls and family dinners. Nothing extreme, nothing faddish, only practical changes shaped for everyday American life. One more important note as we get moving. Precision matters. Amounts, timing, and preparation can make the difference between relief and more irritation. Brew time changes acidity. An extra teaspoon of a spice changes how tissues react. Even the temperature of a drink can alter comfort. That's why it's worth staying with me until the end of this journey. I'll teach the safest, most reliable versions of each step, measured, simple, repeatable. And there's an extra gift waiting, a 90-second calming routine you can use exactly when urgency hits in the checkout line or while you're fishing for keys at the front door. Consider it your pocket tool. I'll walk you through it when we've laid the groundwork. To set expectations, you're not going to hear miracle claims here. We're aiming for steady wins. Fewer nighttime wake-ups, less sprinting, more confidence for long drives, or a movie without scoping out the aisle seat. Some people notice a small improvement within 3 days. Others need a couple of weeks, especially if stress, spicy game day wings, or highly carbonated drinks have been regular companions. The body is honest. It tells you when something soothes or stings. Our job is to listen and respond. Let's briefly name the main players we can influence. Irritants in drinks and foods can poke at the bladder lining. Carbonation, caffeine, strong acids, artificial sweeteners, and very spicy sauces are common culprits. Nerve arousal, think tight shoulders, shallow breathing at your desk, or white-knuckle traffic, acts like a megaphone. The pelvic floor, too, can become overprotective. It holds tight instead of coordinating smooth release. If you've ever clenched during a sharp urge and felt the sensation get worse, you've met that reflex. You'll learn a better one soon. I know the American routine well. A large commuter mug of coffee at dawn, drive-through breakfast, grabbing a diet soda at lunch because it feels lighter, then refilling it again because refills are free. A spicy takeout dinner, maybe a microbrew to unwind, then sparkling water on the couch because it tastes more exciting than plain. None of this makes anyone a villain, but all of it, combined, can keep the bladder in a slightly irritated, over-signaling state. The upside is that very small swaps pay dividends. A smoother brew, still water over bubbles, gentler seasonings, and smarter timing. I want you to feel both respected and empowered, so we'll move step by step. First, we lower the background noise. Remove the loudest triggers for just 72 hours to give tissues and nerves a break. Next, we retrain the signal. Teach the bladder to wait comfortably. Then we fortify the system with nutrition that favors calm muscles and steady hydration. Finally, we add that 90-second technique that helps you navigate the real world when a sudden urge arrives in the middle of a meeting or on a highway exit. You won't need fancy equipment, and you won't need to overhaul your life. You'll need a small pitcher, a timer on your phone, and a willingness to notice cause and effect. As we proceed, remember that overdoing any healthy habit can backfire. Chugging enormous amounts of water late in the evening can flood the night and steal deep sleep. Abruptly, quitting caffeine without a plan can bring headaches and fatigue, which raise stress and, ironically, drive urgency. Strong herbal infusions, if brewed too long or taken in large amounts, can irritate rather than soothe. This is why I'll be precise about amounts and preparation when we get to them. Measured changes are kinder to the body and easier to sustain. Here's your first empowering thought to carry forward. Age-related does not mean irreversible. It means the system is sensitive to inputs, and you can change those inputs. When you change the inputs, the messages change. When the messages change, the habit loop shifts. It's both science and common sense applied to your daily coffee, your lunchtime drink, and the way your muscles coordinate with your breath. A calmer bladder is not only about fewer bathroom trips, it's about more freedom to linger on the porch after dinner, to say yes to a road trip, to sit through your granddaughter's recital without planning an aisle escape route. Stay with me, because the next practical tip is one of the most important, and skipping it tends to minimize results and can even cause unwanted side effects, like substituting one irritant for another, or changing intake timings in a way that disrupts sleep. I'll show you how to avoid those pitfalls with clear, friendly instructions so you can move forward confidently. Quick reminder before we continue. This is educational guidance to help you make informed choices. If you live with medical conditions, take diuretics, blood thinners, or have a history of urinary issues, check with your clinician before changing routines. Precision matters here. Quantities, brew times, and timing during the day can change how your body responds. A moment ago, we uncovered something liberating. Sensitivity isn't destiny. Now it's time to lower the background noise so your bladder can relearn calm. Think of this as a gentle 72-hour reset tuned to everyday North American habits. We're removing the loudest triggers, not forever, just long enough to let tissues settle and nerves stop shouting. You'll still eat real food, sip comforting drinks, and live your life, just with smarter picks and clear boundaries. Start with the morning ritual that so many of us cherish. Coffee. Caffeine and certain brewing methods can irritate the bladder lining and amplify urgency in sensitive people. You don't have to abandon the pleasure of a warm mug. You do want to tame the chemistry. For 3 days, swap the giant commuter cup of strong drip coffee for a small serving of smooth decaf cold brew or a half-calf made with a coarser grind and filtered water. Cold brew extracts fewer acids. Decaf keeps stimulation low. If you prefer hot, warm the decaf cold brew gently on the stove, don't boil, and stop at 8 to 12 ounces. Park the energy drinks. Their caffeine, carbonation, and sweeteners stack irritation in 3 different ways. Next, address fizz and acid together. Carbonated water, diet sodas, and citrusy soft drinks feel refreshing, especially with the American habit of free refills. But the combo of bubbles, acid, and certain sweeteners can keep the bladder on edge. For the reset window, go still and simple. Plain filtered water at room temperature or slightly warm, sipped rather than gulped. If you want flavor, steep a mild herbal tea. Chamomile or roasted barley tea are classic gentler choices. Precision alert. Brew chamomile off the boil for 5 to 7 minutes. Longer steeps can become bitter. Skip lemon slices. Avoid vinegar-based tonics. And hold off on sparkling water. Yes, even the fancy canned ones. Now, turn down the heat on your plate. Spicy sauces, buffalo-style wings, jalapeno-heavy salsas, and tomato-rich pizza night can tug at sensitive tissues. Over these 72 hours, choose milder flavors. Roasted chicken with olive oil and herbs, baked salmon, turkey meatballs with a light cream or olive oil-based sauce. If you're packing lunch, swap the deli meats, often high in sodium and preservatives, for last night's roast with sliced cucumber or a simple spinach salad. Sodium pulls water and can lead to both thirst and nighttime trips. Easing up helps your system breathe. Let's talk sweeteners. Many diet beverages and sugar-free candies use sugar alcohols or aspartame, acesulfame K, which can provoke urgency for some. When you want something sweet during the reset, reach for a small bowl of berries or a sliced pear. If you're used to chewing gum all day, pick an unsweetened or lightly sweetened option and notice how your body responds when you scale back. Hydration timing is your unfair advantage. Instead of chugging late in the evening because you forgot to drink at work, front-load your fluids during the day and taper at night. A practical pattern looks like this: a full glass of still water with breakfast, one mid-morning, one with lunch, one mid-afternoon. After that, sip slowly and stop large volumes about 3 hours before bed. Pair this with a relaxed bathroom visit an hour before sleep, not forcing, just giving your body a calm chance. This schedule respects deep sleep and reduces the just-in-case loop that trains the bladder to wake you. To make the reset concrete, use a tiny pocket notebook or the Notes app on your phone as a bladder journal for these 3 days. Jot down what you drink and when, how often you void, and any urgency spikes. No judgment, just data. You'll likely notice patterns as fast as day 2. Maybe carbonated waters are sneakier irritants than coffee for you. Maybe spicy Friday takeout is the real trigger. With that clarity, you can reintroduce favorites later, one at a time, and decide what's worth it. Here's a simple grocery list that keeps you satisfied without poking the system. Still water, decaf coffee beans suitable for cold brew, chamomile tea, old-fashioned oats, plain yogurt, ripe bananas, pears, blueberries, baby spinach, cucumbers, carrots, roasted almonds, pumpkin seeds, chicken thighs, salmon fillets, brown rice, and olive oil. If you enjoy a snack during the big game, try a small handful of unsalted pumpkin seeds and a sliced pear instead of hot chips and soda. If you miss the fizz, remind yourself, it's 72 hours. You can reassess once tissues quiet down. 2 cautions keep this reset safe and effective. First, don't overcorrect by flooding yourself with liters of water out of fear of dehydration. That can provoke more urgency and disturb electrolytes. Sip steadily, notice thirst, and keep your urine a light straw color. Second, if you're very caffeine dependent, taper rather than quit cold turkey to reduce headaches and grumpiness. Half calf today, decaf tomorrow, then herbal the day after. Your nervous system will thank you, and calmer nerves mean a calmer bladder. As the reset unfolds, pay attention to how your body feels around common American routines. The afternoon slump at the office, the freeway commute with a takeout cup in the console, the habit of a nightcap. You're not being asked to become a different person. You're learning which levers create comfort. Many people notice that within 3 days, the nighttime bathroom trips drop by 1, sometimes 2. If that's you, celebrate the progress without getting cocky. Consistency deepens the gains. If you're not there yet, keep logging. You may discover the key is actually reducing tomato-heavy dinners or switching from sparkling water to still. When the 72 hours wrap, you'll be ready to layer in a skill that changes the game. A way to settle the nervous system during a sudden urge so you can walk calmly to the bathroom rather than rushing or clenching. Before we get there, carry this with you. The reset is not punishment. It's a quieting phase. It sets the stage for resiliency, better sleep, and the freedom to say yes to a movie, a hike, or a long drive without scouting every restroom on the map. Stay tuned, because the next tip is one of the most important, and skipping it often leads to minimal progress and may cause unintended side effects, like replacing caffeine with highly acidic or artificially sweetened drinks that keep irritation high. I'll guide you through a safer, more effective alternative so you can keep your momentum without guesswork. If you've begun the gentle 72-hour reset, you've already done something powerful. You lowered the background static that keeps the bladder on edge. With the volume turned down, the next move is to retrain the wiring so the body interprets sensations more accurately. Think of this as upgrading the conversation between your bladder and your brain so the messages arrive in full sentences, not in all caps alerts. Here's a picture you can keep in your mind. As the bladder fills, stretch receptors send messages up the spinal cord to the brain. The brain is supposed to weigh that message alongside context. Are you in the middle of a meeting? Are you driving? And then coordinate a calm yes or not yet. With age, stress, long hours of sitting, and certain food and drink patterns common in North American routines, that conversation can become jumpy. Small stretches get labeled as emergencies. We react by hurrying, just in case, which trains the system to expect frequent trips. The goal now is to interrupt that loop and install a steadier rhythm. Start with the moment that matters most, the first hint of an urge. Most people clench everything, jaw, glutes, abdomen, and pelvic floor, and rush. That makes the signal louder. Instead, practice the opposite response. Pause where you are, plant both feet, and unlock the jaw by letting your tongue rest on the floor of your mouth. Uncross the legs. Now use the exhale first rule. Breathe out slowly for 6 seconds, then inhale gently through the nose for 4, hold for 2, and exhale again for 6. During the exhale, imagine the base of your pelvis widening and softening, as if the sit bones could grow a millimeter farther apart. This is a reverse contraction, more like releasing a fist than squeezing it. 2 or 3 cycles often take the edge off the wave. Pair the breath with a tiny attention shift known as grounding. Name, in your head, 2 colors you can see, 2 textures you can feel, the steering wheel, the fabric of your jeans, and 1 sound in the background. You're not ignoring the body. You're lowering the megaphone effect that stress has on bladder messaging. As the wave eases, walk, not rush, to the restroom if you truly need to go. If the sensation fades, set a timer for 5 minutes and continue what you were doing. That small delay is not about holding it at all costs. It's about proving to your nervous system that urgency can be negotiated safely. Build a simple practice session once or twice a day when you're at home. Choose a time you usually feel steady, perhaps late morning or mid-afternoon. Drink your normal amount. When you notice the first urge, do 3 rounds of the exhale first breathing and pelvic release. Then delay for 3 minutes while you stay relaxed and upright. If you feel comfortable, add 2 more minutes. If your body says no, honor it and go. This graduated approach extends comfort without strain. Posture and pressure matter too. Hours in a soft couch or slumped over a laptop compress the abdomen and send constant pressure downward. Twice a day, stand with your back against a wall, heels 6 inches away, and breathe into your sides and back for 5 slow breaths, feeling ribs expand sideways like a flexible belt. This redistributes pressure and helps the pelvic floor learn its role as a dynamic trampoline, not a clenched guard. A quick note on what not to do. Avoid doing hard pelvic squeezes during a surge of urgency. Strong contractions at the wrong time can make the reflex tighter, not calmer. Save dedicated strength work for relaxed practice times. We'll outline a gentle plan for that soon. Right now, the priority is coordination and confidence, teaching your system that it can feel an urge and stay composed. Because real life is full of triggers, create a few cue-based routines. For the office worker who reaches for a 3rd coffee during the afternoon slump, replace that moment with a 2-minute desk reset. Stand, shake out the legs, do 3 exhale first breaths, sip still water, and stretch your upper back by hugging yourself and breathing into the space between the shoulder blades. For the driver who feels a surge pulling into the driveway, turn the car off, rest both hands on the wheel, and perform 2 slow breathing cycles before you even reach for the seatbelt. These micro-rituals turn high-risk moments into practice reps. If anxiety tends to spike your signals, borrow a simple tool from sports psychology called segmenting. Rather than picturing the whole evening without bathroom access, dinner, the movie, the drive home, focus on the present segment only. Order dinner. Enjoy the first course. Breathe through 1 urge wave and walk calmly to the restroom if needed. Segment by segment, you'll learn that comfort is a trainable skill. Keep using the bladder journal from the reset, but add a small symbol when you use the exhale first technique and note the outcome: faded, manageable, or strong. Patterns appear quickly. Many people notice that the most dramatic improvement happens not at their desk, but in line at the grocery store or right as they turn the key in the front door. Classic condition triggers. Seeing progress in those moments is a genuine confidence booster. Safety first. Never delay voiding in the presence of pain, burning, fever, or visible blood. Don't use these techniques to push through significant discomfort or to win a contest with your own body. The purpose is comfort, not heroics. If you live with neurological conditions, pelvic pain, or have had pelvic surgery, tailor these steps with your clinician or a pelvic floor therapist. When these practices become familiar, something subtle but meaningful shifts. Your relationship with urges feels less like crisis management and more like skillful dialogue. That change reverberates through everyday American life. Sitting through a ball game without scouting the aisle seat, getting through traffic without tension, enjoying a long phone call with an old friend. The body trusts you more, and you trust the body. Carry this with you as you move forward. Calm is not passive. It's an active state you can create with breath, posture, and attention. 10 calm reps spread across a day are more useful than one heroic effort. Keep the routine gentle, keep the records honest, and celebrate small wins like an uninterrupted meeting or one less nighttime wake-up. Those are not small at all. The next tip is one of the most important, and ignoring it won't just limit your results. It can also lead to unintended side effects, such as reinforcing unhelpful patterns or straining when you shouldn't. So take it seriously in an informed, measured way. You've been practicing quieter inputs and a calmer response to urges, and that foundation pays off now. The body learns fastest when the message is consistent. Fewer irritants, steadier breathing, and a confident walk to the restroom instead of a sprint. With that stability in place, it's time to build capacity and coordination so your bladder can comfortably wait, your nights feel longer, and your days feel less interrupted. This isn't about stoicism or holding it. It's about teaching timing, strengthening what needs strength, and relaxing what needs release. Begin by discovering your real baseline. For 2 typical days, record the clock time whenever you void without trying to delay. Note fluid intake alongside, especially coffee, tea, sodas, sparkling waters, and alcoholic drinks. Many North American routines include a large morning coffee, a diet soda at lunch, and sparkling water in the evening. Knowing where those sit in your day helps you plan. Calculate the average interval between bathroom trips during waking hours. That number, say 75 to 90 minutes, is your starting point, not a failure grade. Now create the gentlest possible progression. Add just 5 minutes to your average interval and aim to reach that mark before you head to the restroom. If your baseline is 80 minutes, set a quiet phone reminder for 85. When the timer chimes, check in. If you feel genuinely comfortable, walk to the restroom and go. If you feel an urge before the timer, use the exhale first technique and the pelvic release you've practiced. If the urge settles, continue your activity and see if you can reach the target window without strain. If discomfort mounts, honor it and go. You'll try again later. After 3 to 4 days at a given interval, add another 5 minutes. The goal is a comfortable window of 2 to 3 hours for many adults, with plenty of individual variation. To keep training humane, insert relief checkpoints in predictable high-trigger slots, the end of a long meeting, the last 5 minutes before leaving the office, or after parking the car at home. Calm, unhurried visits prevent the cycle of clench and sprint. At night, pair the schedule with a taper. Drink most of your fluids before late afternoon, sip in the evening, and avoid large volumes for the final 3 hours before bed. Keep caffeine and alcohol outside the 2 hours before bedtime. A relaxed bathroom visit an hour before sleep often reduces wake-ups without the need for extreme rules. Now let's add strength with care. Pelvic floor training is not about constant squeezing. It's about rhythm and recovery. To locate the right muscles, imagine stopping gas, not urine flow, then release fully. Lying down or seated comfortably, perform 5 to 10 gentle contractions. Inhale to prepare. Exhale as you lift the pelvic floor as if drawing a tissue upward through a straw. Hold for 3 seconds, then let go entirely for 6 seconds, feeling the base soften. Keep jaw, abs, and glutes quiet. Do 1 or 2 sets per day on non-consecutive times, such as mid-morning and early evening. Quality beats quantity. Too many reps can create tension that backfires. Add coordination drills called quick flicks once per day. 3 light, rapid lifts with full releases between them. These help with sudden stressors like a sneeze or a laugh. Balance those with lengthening breaths. 3 slow exhales where you picture the base widening, so training doesn't become all squeeze and no ease. If you ever feel heaviness, pain, or increased urgency from the exercises, reduce the volume or consult a pelvic health professional for a customized plan. Bowel habits play a larger role than most of us realize. Straining on the toilet increases downward pressure and can irritate a sensitive bladder. Make mornings friendly. After breakfast, drink a glass of still water, take a short walk around the block or up and down a hallway, and sit with a small footstool under your feet so knees rise above hips. Lean forward slightly. Rest your forearms on your thighs, relax the belly, and breathe out gently. Aim to build fiber gradually from foods. Old-fashioned oats, beans, lentils, pears, berries, leafy greens, and pair that fiber with steady hydration through the day, not a flood at night. If you add seeds like ground flax to yogurt or oatmeal, begin with a teaspoon and notice how you feel. More isn't always better. Toilet mechanics matter for complete, easy voiding. When you do urinate, give yourself time. Relax shoulders and jaw, rest feet flat, and breathe. If you suspect you didn't empty comfortably, wait 30 to 60 seconds and try again without straining. Avoid pushing or bearing down. That can contradict everything you've trained. In public restrooms, resist hovering if possible. Supported sitting helps the pelvic floor coordinate. Build the plan into everyday American life. For commuting, schedule a calm bathroom stop before a long drive and bring still water instead of a giant iced coffee for the car. At the office, replace the habit of a late afternoon diet soda with a short walk and a glass of room temperature water. At the ball game or a movie, choose an aisle seat only if it makes you feel relaxed, not because you expect to sprint. That mindset shift, confidence over contingency planning, supports the nervous system as much as the muscles do. Expect progress that looks like this. In the first week, your average daytime interval holds steady or climbs by 5 to 10 minutes with less drama around urges. By the second week, you may notice 1 fewer nighttime wake-up. The wins are small on paper and large in life. Finishing a conference call without distraction, walking the dog an extra block, lingering over dessert with family. Keep celebrating without adding pressure to perform. A few safety notes keep the process balanced. Pain, burning, fever, visible blood, or new leakage deserve professional evaluation. These steps are not a substitute for personalized care. Don't delay urination if you feel unwell, and don't turn training into a contest. This is not a grit challenge, it's coordination practice. As you refine timing and strength, keep the spirit of the approach. Gentle, consistent, precise. Add 5 minutes only when the body says yes. Choose foods that support comfort rather than chasing extremes. Maintain the breathing and release techniques so strength and softness grow together. The payoff is autonomy, unhurried evenings, deeper sleep, and the quiet confidence that comes from a body you can understand and influence. The next tip is one of the most important, and ignoring it won't just limit your results. It can also create unintended side effects such as over-tightening or disrupted sleep from poor timing, so approach it carefully and apply it exactly as instructed for safer, steadier progress. Your timing is getting smarter and your breath is doing real work. There's one more lever that quietly influences everything you've been practicing, what sits on your plate and in your mug. Food and fluids won't replace skill, but they can make skill easier. Think of this as training the chemistry to match the behavior. Let's start with a surprise hiding in a fall tradition. The humble pumpkin, yes, the same one carved on porches, carries seeds that many people find supportive for bladder comfort. A small handful delivers minerals like magnesium and zinc, along with plant compounds that seem to favor calm muscles. We're not promising miracles. We're talking about giving your tissues a friendlier background. 2 simple ways to try them. Sprinkle 1 to 2 tablespoons of unsalted pumpkin seeds over oatmeal or Greek-style yogurt at breakfast, or toss them onto a spinach and roasted chicken salad at lunch. Chew well. If you prefer ground seeds, pulse them briefly in a coffee grinder and store in a jar in the fridge for up to a week. Start low and notice how you feel. Zooming out, the theme is gentle, steady, and low on irritants. Many North American routines accidentally combine 3 things that nudge the bladder at once: acid, bubbles, and sweeteners. If you've been replacing soda with sparkling water, you're a step closer, but bubbles alone can still bother sensitive tissues. For most people pursuing comfort, still water at room temperature or slightly warm is the better everyday choice. If you want taste without tang, try a simple herbal infusion brewed lightly and sipped earlier in the day rather than late at night. Build your plate to help the nervous system settle. Magnesium-rich foods, leafy greens, beans, lentils, pumpkin seeds, almonds, and old-fashioned oats support overall muscle relaxation. Potassium-rich choices, bananas, oranges, cooked spinach, potatoes contribute to fluid balance. Pair them with moderate, steady protein: roasted salmon, turkey meatballs, rotisserie chicken, skin removed, or tofu baked with olive oil and herbs. Favor home-cooked or minimally processed options over deli meats, which tend to be high in sodium and preservatives. Excess sodium can drive thirst and nighttime bathroom trips. Turning that dial down is kinder to your evening. If dairy sits well with you, plain yogurt or kefir can be helpful for gut comfort, which matters more than most people think. A calmer gut means less pressure downward. If you're sensitive to fermented tang or added sugars, choose plain options and use fruit for sweetness. For grains, old-fashioned oats, brown rice, and quinoa beat ultra-refined options that spike and crash energy. Stable energy lowers the afternoon need for a second coffee or a diet soda refill. Here's a simple day that respects training while feeling normal in a North American life. Breakfast: overnight oats made with plain yogurt, rolled oats, a grated apple, cinnamon, and a tablespoon of pumpkin seeds. Mid-morning: still water and a pear. Lunch: a warm bowl with brown rice, roasted chicken, baby spinach, cucumbers, olive oil, and a pinch of sea salt. Afternoon: a cup of gentle herbal tea brewed lightly, plus a handful of blueberries. Dinner: baked salmon, steamed squash, and a small roasted potato with olive oil. Evening: sip water sparingly and stop larger volumes 3 hours before bed. Nothing exotic, just chemistry that helps your training feel easier. A note on fiber: more isn't automatically better. Adding a mountain of raw vegetables overnight can backfire with gas and pressure, which the bladder doesn't appreciate. Build up gradually. If you enjoy adding ground flax to breakfast for regularity, start with 1 teaspoon and work up to 1 tablespoon as tolerated. And like any fiber, pair it with steady hydration through the day. Mind the brewing details that decide whether a drink soothes or pokes. Coffee: if you love the ritual, try decaf cold brew warmed gently. Its lower acidity makes it a friendlier option during retraining. Tea: chamomile or roasted barley tea can feel calming. Brew off the boil for 5 to 7 minutes. Skip long steeps that taste bitter. Bitterness often correlates with irritation. If you rely on a sweet lift, favor whole fruit over artificial sweeteners, which can trigger urgency for some people. Gum lovers: sugar-free gums made with sugar alcohols sometimes stir up the gut, so scale back and notice. Read labels with a relaxed but curious eye. 2 places where sodium hides in American kitchens: sauces and condiments. Tomato-heavy, chili-spiked sauces and very sour dressings can double whammy the system with acid and salt. Keep a bottle of extra virgin olive oil and a small jar of dried herbs on standby. A quick drizzle and a pinch of thyme or oregano turn plain food into dinner without provoking your bladder. Let's put this into a short, doable challenge that folds into your training and breathing work. For the next 7 days, build each meal with a calm trio: a gentle protein, a mineral-rich plant, and a comfort carbohydrate. Examples: turkey meatballs plus sautéed spinach plus brown rice, baked tofu plus roasted carrots plus quinoa, salmon plus mashed sweet potato plus green beans. Add a tablespoon of pumpkin seeds once per day, earlier rather than late. Drink most of your fluids before late afternoon. Keep bubbles and heat, spice, on pause while you pay attention to signals. Track changes: fewer nighttime wake-ups, less urgency in the late afternoon, a longer comfortable interval between bathroom trips. The total picture tells you what's working. A few safety nudges keep everything on the friendly side. If you have allergies to seeds or to plants in the daisy family, skip pumpkin seeds or chamomile and choose alternatives like almonds, if tolerated, or a gentle barley tea. If you take medications, particularly diuretics or blood thinners, or if you live with kidney or digestive conditions, talk with your clinician about portions and timing. And remember the golden rule of this whole series: preparation and quantity matter. Oversteeping herbs, piling on hot sauce, or oversalting healthy soups can erase the benefits you're working so patiently to build. Carry this idea with you. Food is not a switch, it's a volume knob. Turn it toward calm, and everything you practiced in breathing and capacity training becomes more effective with less effort. You'll notice it on the freeway drive home, the office meeting that used to feel risky, and the way your evenings stretch a little longer before you think about the restroom. The next tip is one of the most important, and ignoring it won't just limit your progress. It can also cause unintended side effects, like using strong brews or large evening volumes that disrupt sleep and comfort. So approach it carefully and follow the preparation details exactly as described. Your plate is now working with your practice, not against it. The stage is set for a daily ritual that quietly supports everything you've built so far. A simple, precise infusion that many people find soothing, paired with a 90-second routine you can use in the real world when an urge arrives at the worst possible moment. As always, this is educational guidance. If you're pregnant, nursing, allergic to plants in the daisy family, living with kidney or digestive disease, or taking blood thinners or diuretics, check with your clinician before you change routines. Precision matters here because the same ingredients that soothe in the right dose and timing can irritate when brewed too strong or taken too late. You'll prepare 2 components and combine them: a gentle chamomile tea and a light flaxseed water. Chamomile is included for its calming character. Whole flaxseed adds a mild, soothing gel and supports comfortable bowel habits. We keep flavors simple and avoid acid, bubbles, and sharp spices, so the bladder lining gets a quiet day. Gather your tools and ingredients. Use a clean 1 quart, about 1 liter, glass jar or pitcher, a small saucepan, a fine mesh strainer, and a teaspoon. You'll need 2 chamomile tea bags or 2 teaspoons of loose chamomile, 2 tablespoons of whole golden flax seeds, and 1 liter of filtered water. Optional for flavor: a small cinnamon stick. Avoid lemon, vinegar, or sparkling water in this recipe. Sour and fizz can be provocative for sensitive tissues. Begin with the flaxseed water. Rinse 2 tablespoons of whole golden flax seeds briefly in cool water. Bring 500 milliliters, about 2 cups, of filtered water just to a boil in the saucepan. Turn off the heat, add the rinsed seeds, and cover. Let the seeds steep for 20 to 30 minutes. The water will become slightly thicker with a silky feel. Stir once halfway through. Strain through the fine mesh into your jar. Discard or compost the seeds. Do not grind the seeds for this step. Ground flax thickens too quickly and can be harder on sensitive stomachs when used as a beverage. Prepare the chamomile. Heat the remaining 500 milliliters of water to just below a boil. Take it off the heat, add the chamomile bags or loose flowers, and cover. Steep for 5 to 7 minutes, no longer, to avoid bitterness. Remove the bags or strain the flowers. If using, add the cinnamon stick for aroma, then remove it after 5 minutes. Combine the chamomile with the flaxseed water in your jar and allow everything to cool to a comfortable warm or room temperature. Now set your dose and timing. Aim for 200 to 250 milliliters twice a day in the morning and early afternoon. Sip slowly. This is not a chugging drink. Avoid large volumes in the final 3 hours before bedtime to protect sleep. Store any remaining infusion covered in the refrigerator for up to 24 hours. If cold drinks bother you, pour a serving into a mug and warm it gently. Do not boil. If you notice the drink feels too thick, dilute with still water, not juice or carbonated water. A few guardrails keep this ritual friendly. Skip chamomile if you have known allergies to the Asteraceae family. Ragweed, daisies. If you're on blood thinners or have a history of bleeding disorders, discuss chamomile with your clinician. If you've had bowel obstructions or significant diverticular disease, talk with your care team before using flaxseed water and ensure you're drinking steady fluids during the day. If any symptom worsens, pain, fever, burning, or visible blood, pause the routine and seek evaluation. This is about comfort and autonomy, not pushing through red flags. Pair the infusion with the promised 90-second routine for urge waves in everyday American life. Picture the checkout line, the office elevator, or your driveway as you turn the key. Here's the sequence. First, stop moving for a moment and uncross your legs. Place both feet flat. Exhale slowly for 6 seconds, letting your shoulders drop, then inhale through your nose for 4, pause for 2, and exhale for 6. As you exhale, imagine the base of your pelvis widening and softening, like releasing a fist. If you're seated, feel your sit bones heavy on the chair. If standing, feel weight evenly over both feet. Repeat for 3 to 4 cycles. While you breathe, name 2 colors in your surroundings and 1 texture under your fingertips. This mild grounding lowers the volume on the body's alarm system so you can walk, not rush, to the restroom, or comfortably wait a few minutes if the sensation eases. We also need to speak plainly about what happens when this body-wide conversation is ignored for months. Fragmented sleep from repeated nighttime trips chips away at energy, mood, and balance. That sleepy walk to the bathroom in the dark is when missteps and falls are more likely. Constant urgency can increase skin irritation and, for some, invite recurrent infections or, conversely, make the body more hesitant to empty fully. None of this is about scaring you. It's about showing why these small, precise steps, calmer inputs, smarter timing, and a daily infusion prepared the right way, matter for real-world safety and comfort. Give yourself an honest 2 weeks of consistent practice with this ritual. Keep your bladder journal, noting when you sip the infusion, how the urge routine feels, and how your nights change. Expect modest shifts that add up: 1 fewer wake-up, a longer comfortable window between bathroom trips, more confidence on a long drive, less tension when the door key sticks for a second. Those are genuine wins. When you see them, tell your future self, it's working. Keep going. I'll leave you with encouragement and a simple call to action. Share what helps with a friend who keeps scouting seats near the aisle and invite them into the small steps approach. Gentle drinks, kinder timing, practiced calm. If this guidance makes your week easier, save it, revisit it, and pass it along. Health education builds power when it's practical, respectful, and repeatable. The next tip is one of the most important, and ignoring it won't just limit your progress. It can also lead to unintended side effects like brewing too strong, drinking large volumes late, or forcing delays when your body says no. So apply the guidance precisely and listen to your signals as you continue.